I am Trey Andrews. I am the co-director of the Minority Health Disparities Initiative, and I just want to welcome everyone for our Health Equity Speaker Series today. We're very grateful to have Dr. Athena Ramos here with us. We hope that you will join future Health Equity Speaker Series, which you can find out more about on our website and various social media as well. So please do be on the lookout for those as we have more in the future. For today, as I mentioned, we have Dr. Athena Ramos, who on a personal note has been a great friend and collaborator. Dr. Ramos is an assistant professor in the Department of Health Promotion and is affiliated with the Center for Reducing Health Disparities and the Central State Center for Agricultural Safety and Health at the University of Nebraska Medical Center in Omaha. She leads a Latino outreach and engagement team and serves as principal investigator for a number of community-based health and social research and education initiatives. I've been fortunate enough to collaborate with her on just a few of those. I know she does so much in this area, including things such as occupational health and safety with the agri-food system, immigrant integration and community well-being. She's an experienced administrator, program manager, and researcher. She earned her PhD in International Family Community Studies from Clemson University and has 2 master's degrees in Business Administration and Urban Studies from UNO. She will be here to talk with us, as you can see the title up there, on health and well-being of Latino immigrant cattle feed yard workers in the Central States region. Before we kick that off, just a couple other quick house cleaning kinds of things that we want to mention. So please do feel free to enter questions into the chat as you have them. That includes during the talk. We will get to those at the end, however. Given the way some of this works, we will try to get to as many questions as we can, but we may not get to all of them. But again, like I said, feel free to enter those into the chat, and then we will hold the Q&A until the end. So with all of that, I will turn this over to Dr. Ramos. Thank you again for being with us here today.
Thank you so much, Dr. Andrews. It's a pleasure to be with MHDI. You all have a great space in my heart, and I'm excited to be able to join some of the UNL team, the faculty, staff, and students at UNL, and also some of our partners from all across the state. So as mentioned, today I plan to talk about the health and well-being of Latino immigrant cattle feed yard workers here in the Central States region. And why do I say Central States region? It's because as you heard, I'm part of the Central State Center for Agricultural Safety and Health. So I figured we should start there and talk about what are the Central States. And so here, if you see on the map, you can see 7 states that are highlighted in green. These are what we consider the Central States. So North Dakota, South Dakota, Nebraska, Kansas, Missouri, Iowa, and Minnesota. So this Central State Center for Agricultural Safety and Health is one of the 11 ag centers throughout the country. And our mission is to work with the agricultural community within our Central States region and beyond to conduct research, interventions, education, and outreach activities to try to figure out what are some of the mechanisms of injury and illness and develop and implement and evaluate prevention strategies that improve the health and safety of people who are working in agriculture. So we hope that one day we will have a very vibrant agricultural sector in our region where health and safety is something that's highly valued and work-related injuries and illnesses are something that are very rare. So if you haven't heard about our center, I'd encourage you to check us out. I've left the website here on the slide for you to learn more about CS Cash. So today for our talk, I have a couple of things that I hope we'll be walking away with. One is that you'll learn a little bit more about the demographic characteristics of farm workers in the United States and here in our region. You'll learn a little bit about the cattle feeding industry in our region. We'll talk about health and occupational and social challenges that Latino immigrant cattle feed yard workers face. And we'll talk and identify some of the opportunities and potential resources for trying to assist in meeting the needs of farm worker populations. So kind of an agenda for our time together, for our hour together. We'll first talk about farm workers generally. We'll talk about the cattle industry. I'll share with you some data from a current project that we've been working on over the past 5 years, the health and safety risk among Latino immigrant cattle feedlot workers in the Central States region project. And we'll talk about how do we respond to some of these health and safety concerns. And then at the end, as Dr. Andrews mentioned, I'll take questions. So first, let's talk about some of the demographics of farm workers generally all across the United States. So there's an estimated 2.5 million farm workers in our country. They're majority male, but there is about 1/3 of the workers who are female. About 44% are under the age of 35. And we do see that there is about 25,000 children who are between the ages of 14 and 17 who are working in agriculture. So that's a little bit about the population, but I do want you to note that this is really difficult to be able to collect accurate data on worker populations because there's a lot of mobility, there's language and cultural barriers, there's a lot of fear about sharing information due to immigration status. And so take all of what I say today around these demographic characteristics with a grain of salt. We'll continue. All right, so here we see that about 74% of workers speak Spanish. So Spanish is the dominant language among ag workers. We do see that about half of the worker population is working undocumented or without work authorization here in the country. And about 75%, 76% are foreign-born individuals who are primarily coming from Mexico, but we do see a growing number of workers who are coming from Central America, countries like Guatemala, Honduras, El Salvador, and part of that, as you can imagine, is attributed to some of the economic hardships and the instability in the region. Generally speaking, we do see that workers have a fairly low level of formal education attainment. So on average, looking at crop workers across the country, that's about an 8th grade education. You can see also that the income levels are quite low, very low. So individual income range from about $17,500 a year to about $20,000 a year. About 1/3 of farm worker families are living at 100% or below the federal poverty level. About half of workers report not having health insurance, and 37% said that they had not seen a healthcare provider in the last 2 years in the United States. All of this data is coming from the National Agricultural Workers Survey. And so they collect data from crop workers, but this is one of the only national sources of data on farm workers. That's why I share this with you. So US agriculture is really dependent upon an immigrant workforce because there's a lot of challenges in being able to recruit and retain the workforce that is needed for all of the production that happens within our country. And so we're turning to a number of different strategies. So on the farmer or the producer side, they're looking at ways that they can try to keep people, retain them, stretch the current workforce that they have, figuring out ways to automate or substitute machines for human production activity, or finding ways to supplement the current workforce with immigrant workers. And really that last strategy, the supplement, is where I think a lot of the focus and a lot of the attention has been over, especially the last decade. And so what we see in the field is that there's a lot of dependency upon an immigrant workforce. You can see from bullet number 2 that about 75% of the people who are working with crops in the country are immigrant workers, and about half of the folks who are working with livestock are immigrant workers, and about half of those in general are undocumented individuals. So there's lots of reasons, lots of reasons why people may be coming to the United States. For those of you who've had a little bit of migration studies and sociology, you know that there's some push and pull factors. Push factors are the things that drive people to move voluntarily or force from where they came from. Pull factors are things that attract people to come. So on the push side, we know that, violence and war and persecution, not being able to support your family, having limited economic mobility, natural disasters, and really just not having what you need to be able to care for yourself and your family are often really big push factors driving people into the United States. On the pull side, here, there tends to be a prospect of higher wages. So what we see as, poverty level wages may be significantly better from an immigrant worker's perspective from where they were coming from. They may have better availability of food, resources, housing. They may feel safe, and that may drive people to be here or have a little bit more stability. So those are also things that bring people to the country. So we see people from both ends of the spectrum, people who are coming here quite voluntarily to seek that better life, and people who are, leaving some really dangerous circumstances to come to the United States. And farm labor tends to be one of those areas where people can usually find a job because there's so many positions available and there's so much need, and there's not that many people here within the country who are willing, able, and available to do that kind of work. So they come and they find jobs. Now, that's not all in all a bad thing. However, the ag industry is one of those industries that it plays by its own rules. So there's this concept of agricultural exceptionalism. What this means is that they kind of do their own thing. So like any other industry, from education to manufacturing, any other industry, let's say, they have to follow certain rules. For example, if you work over 40 hours, you get paid overtime, or you can't hire kids to work. Those are things that is pretty standard all across industry. However, in agriculture, it's quite acceptable. And so this idea of agricultural exceptionalism is a form of structural oppression, right? And it's leaving farm workers out of most of the major worker protection laws that we have here in the United States. So this exemption of agriculture from social, from labor, health, and safety legislation, it reinforces this idea that agriculture is somehow unique, and that the farm sector has and remains this industry with its own special needs and its set of very, special interests. And so on here, on the bullets on the slide, you can see that there's a number that I call out. For example, the Fair Labor Standards Act. I mentioned that all other industries, they pay overtime if you work over your 40-hour work week. In agriculture, you don't have to do that. We don't have as many child labor protections. So for example, a child as young as 12 years old could be working however long that the parent agrees that they could in the field, right? Workers may or may not be covered by workers' compensation laws. Minimum wage laws don't always apply to farm workers. Farm workers don't have protections under the National Labor Relations Act. So there's no real protection for collective bargaining. So if you want to be part of a union, it's kind of at your own risk. Because there isn't that protection in place. And there's really very few occupational safety and health administration, or OSHA, standards that are out there to protect farm workers. There's one like a field sanitation standard, which talks about pesticides and that type of thing. But a lot of the OSHA standards, they just really aren't, they don't exist. And if they do, they're quite outdated. And finally, if a farm doesn't have more than 11 hired workers or full-time workers, then the enforcement of these OSHA regulations is not always applicable. Like OSHA will not enforce these regulations on small farms. So you can see that there is a lot of loopholes in the laws and in the what is supposed to be out there to protect workers. Now, if we think about Nebraska kind of as a case study, I can tell you that ag workers are excluded from the state minimum wage. Now, here, we do not require any overtime pay. So if you work 40 hours, you work 60 hours, there's no overtime. It doesn't much matter. And, in some states and in some countries, agriculture is considered a hazardous occupation. And I'll get to talking to you a little bit more about that later. But here in Nebraska, there was actually a court case which upheld the idea that farm labor is not a hazardous occupation. And therefore, there was an exemption to workers' compensation. So there's not a workers' compensation protection for farm workers here in the state of Nebraska. So what does this mean? It means that we're reproducing a system where this of farm labor that really hinges on the inability of migrants or individuals, either as people themselves or as a group, to be able to influence the institutions that subordinate them to other parts of the labor force and to their employer. And so in a way, we could talk about this as a form of structural oppression, but as structural violence. And we call it structural violence because the arrangements are structural, because they're embedded into the political and into the economic system, and they're violent because they cause injury to people. So these are individuals who are doing a lot of hard work that most people don't want to do, don't want to be engaged with, and they're experiencing some very challenging conditions. So I told you about how agriculture is really dependent upon an immigrant workforce. Over time, we've seen a lot of changes in the patterns of migration. So before, when we were thinking about, farm workers, we were thinking only in terms of crop, fruit and vegetable production, that type of thing. And so the, workers would start, in a certain part of the country, and they'd travel up this stream to try to find work throughout the year. And so if you look at the left, you can see kind of those traditional migration patterns. So there were three streams. There was a western stream where people would start in like Arizona, California area and kind of work their way up following the crops. A midwestern stream where people would start in Texas and work their way up, again following the crop cycle, and an eastern stream starting in Florida and working all the way up the eastern coast through New York and Maine. However, life has changed, production has changed, immigration law has changed. And so now we see quite different patterns of migration of farm workers. There's really three different patterns that we see. One is a restricted circuit. So if you look over on the right side of the new map, you'll see little orange circles. So you'll see like an orange circle in North Carolina, an orange circle in California. And what this shows is that people are staying within that general area and working through various commodities. You will see a point-to-point pattern. This is a very common pattern here in Nebraska. So people may come directly from Mexico. They come to work, detassel or corn in the summer, for example, or sort seed corn in the fall, and they go right back to Mexico. And then the third pattern that we see is more of a nomadic pattern, which is, maybe perhaps a worker is starting in Mexico. They might go up to California, or up to Washington, work their way down the western coast, or somebody comes to Nebraska, they go on to Iowa, Michigan, Minnesota, maybe down to Florida. And so it's kind of all over the place. And so these are important to know, because oftentimes we think still in the traditional mindset of these three streams, and the reality of where people are coming from and where they're going is also quite different. So it's important to know that, because one of the things that we hear a lot about is how there's a lack of labor that's available here in the state and all across the United States. And so people are relying on these visa programs to supplement the number of workers. As I mentioned, that's really the key way that they're trying to overcome this issue. And so one of the programs that is most widely used is called the H-2A guest worker visa program. Perhaps you've heard about it. It's oftentimes in the news. But what this program does is it allows farm employers who meet specific requirements to bring foreign workers into the United States to fulfill temporary agricultural jobs. So on the employer side, there's a number of things they have to do. First, the job has to be temporary or seasonal. They have to demonstrate that they can't find enough people in the United States who can actually do the work, who are willing, able, qualified to do that work. They have to prove that hiring these foreign-born individuals is not going to adversely affect the wages of U.S. workers, and they have to get a certification from the Department of Labor. So about 95% of all of these H-2A visas are issued to Mexican nationals. The program also has requirements. So once you get certified and you get your positions approved, then it has requirements that you as an ag employer have to abide by. You have, which are listed on the bottom of the slide. So for example, there's a concept called the adverse effect wage rate. And basically, that means that you have to pay a specific minimum wage, and you have to, it's based on a number of factors. I'll show you the slide here in a minute, which has that adverse effect wage rate for each state. You have to abide by the 3/4 guarantee, which means that you must guarantee that you will pay the workers for at least 75% of the hours that are included in the contract. You have to provide meals. You can still charge for the meals, but you have to provide meals. You have to provide safe housing. You have to provide transportation into the country and also to and from the work site. You are required to have workers' compensation. And of course, you have to have plenty of record keeping and maintenance of those records for various departments. So here you can see the adverse effect wage rate for 2022. If you look at Nebraska, the rate here is $16.47 per hour. So if you're hiring on an H-2A visa, this is what the minimum that you must pay to the folks that you are bringing in as part of that program. Again, you only have to pay 75% of the contract. So let's say, your contract is for 8 weeks and you're done in 6 weeks. You only actually have to pay for those 6 weeks, because that would be the 75%. This H-2A program is growing and growing fast. This is probably the first place that agricultural producers look if they're not, if they're thinking about bringing in individuals to work, they look at this particular program. So the number of H-2A positions that were certified here in Nebraska grew from 967 in 2016 to about 2,700 workers in 2020. So this is about a 200% increase. There was a slight decline in 2021. As you can imagine, COVID did hit a little bit in the farm sector. But it's still above what we were seeing in years past. About 44% or so of these positions were for equipment operators, about 30% were for crop farm workers, and about 11% of the positions here in our state were for livestock workers. Now, this program isn't as widely used in livestock, because livestock is something that takes, usually it takes year-round work. Like, you have to feed the animals every day. There isn't such a cyclical nature or seasonal nature to the work. So that's why there's less use of the program with livestock. This program is growing all across the United States and all the other states. We've seen lots of increases in Indiana and Illinois and Iowa. They all had record numbers of guest workers. So this is a program definitely to keep your eye on. If you're doing any work in the farm worker space, you will probably run into people who are working on with this visa. Another visa, a very uncommon and unfamiliar one, but we've learned quite a bit about it lately, is called the TN visa. And so this TN visa was created under NAFTA, the North American Free Trade Agreement. And so it created some special economic and trade relationships between the US, Canada, and Mexico. So this TN is a non-immigrant classification given to Canadian or Mexican individuals who come to work in the United States at a professional level. So they have a list of all of the different types of professions that would qualify under the TN visa. It is not specifically just for agriculture, but you can see that I've given you some of the common agricultural type careers that are often granted under this TN visa. So you might have an agricultural engineer, an agronomist, meat and poultry scientist, or veterinary care professionals. You can stay up to 3 years with this visa, and spouses and children can also join the worker under a different visa classification called a TD visa, but they can't work while they're here in the US. This one is much more, we found it much more common in the livestock industry because you have the opportunity to have people for three years year round, and you're bringing in people who have a professional level of skills. So we're seeing a lot of people who may have been trained as veterinarians in their country, or veterinary care technicians, those sorts of people who may be coming to work in our livestock industry here in the Central States region. Okay, now switching gears. So we're here, Minority Health Disparities Initiative. So I'm guessing you've all heard the World Health Organization's definition of health, a complete state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. And those are, our health is a function of many things, including these social determinants of health, which are these conditions in which we're born, we grow, we live, we work, we age, that are shaped by all of these macro and structural forces like money and power and resources at various levels. So farm workers, they face a lot of challenges for their health and for their well-being, whether it's physical, mental, or social well-being, and many of the structural factors that influence those. For example, there's lots of differences in language and culture and health beliefs. As I mentioned, we have a growing number of farm workers who are coming from other parts of the world, not just Mexico. And there's a lot of people coming from Central America. And so Spanish isn't the only language anymore. So we've got to be very open and understanding and try to find resources that may exist in some of the indigenous languages, like primarily Mayan indigenous languages from that Central American region. There's differences in beliefs, like what caused an illness, or why do you need to go to a doctor for preventive care? People go to the doctor when they're sick. So there's this dichotomy, like this differences in the perceived value of preventive care. Also differences in terms of Western medicine, what most of us are very accustomed to here, versus traditional medicine, and how do you make sense of it all? Oftentimes we find that workers have very low health literacy. The way that we would measure health literacy would be quite low among these workers. And this is important because it affects their ability to navigate the healthcare system, whether it's filling out forms or being able to even find and access services and providers. It may also affect how they share personal information, like their health history with providers. And it also influences how people engage in self-care or management of chronic conditions, or being able to understand things like, what is my risk and how do I figure that out? We see a lot of challenges in terms of logistical concerns for farm workers. For example, do you have transportation access? Like, you're in a very rural, remote place. Do you have access to transportation to be able to get you to a clinic, to a provider? For migrant workers, seasonal workers, sometimes there's frequent moving. As I mentioned, people might be coming from Mexico to Nebraska and going back, or they might be moving within the state, but they're not staying in one community for that long. And so being able to understand community structures, community resources can be quite challenging for them. A lot of our rural and remote areas still don't have broadband access. So how do you find information if you can't have the internet? I mean, I've been to a number of places here in our state doing some outreach work with farm workers, and I don't even have a cell signal. So this is a very real issue. We also see that, building trust can be really challenging. There's a power differential between providers or public health professionals and workers. There's a lot of fear, particularly around immigration. And are you going to disclose my immigration status? Why do you want to know that? Are you going to call ICE on me? So that's a real issue, and trying to gain access to workers can also be an issue. So we work with a number of partners all across the state to be able to gain access to workers, but it took a long time to establish those relationships so that the partners know they can trust us, that our word is good, that they can, and our heart is in the right place. But that's not true for everybody. And sometimes, as I said, it can be very time consuming for you to be able to build those relationships. And so be aware of that. And workers, they also may be not just unaware of the resources in the communities, but they may be unaware of their rights as a worker. Especially if you're coming from a different country, you may not know that you have specific rights as somebody employed in the United States, regardless of your immigration status. And of course, there's a lot of challenges related to access to care in terms of knowing where a healthcare provider is, a clinic, a hospital, an individual provider, the hours of operation. Many of these farm workers are working 10, 12, 14-hour days, not just 5 days a week, sometimes 6 days a week, 7 days a week. And so hours of operation might not always work for the farm worker community. They may not have the ability to miss work, especially if you're here on one of those short-term visas like the H-2A program. You're here for 6, 8 weeks, 12 weeks, whatever it might say in your contract. And your employer is probably going to hold you to that unless there's something really, really wrong. And so you may not have that ability to miss work and be able to go find services. Cost of services is a real challenge. As you saw in the beginning, the average income for an individual farm worker is $17,500 to $20,000 a year. There's not a lot of disposable income that's left there. And many workers do not have health insurance, as I mentioned. So these are, some of the major concerns. You can see on the right side of the slide that some of these challenges are mediated by, the mobility of the population, by the formality of the contract or the employment arrangement, and the legal protections that go with that. And of course, individuals who are victims of labor trafficking, they have, they have so much going that's creating a lot of uncertainty in their lives, but so do undocumented workers. I mean, so there's a lot of things that you need to take into consideration as you're thinking about working with the farm worker population. Not to mention that there are various structural concerns with differing definitions of migrant, seasonal, immigrant, ag worker. Even within the federal government itself, different agencies have different definitions. And so a person may qualify for something in one, under the Department of Labor, but they may not qualify under the Department of Education, or vice versa, or maybe they don't meet the definition for HRSA. So a lot of things. These are structural concerns, structural challenges that we see within the farm worker community. Just wanted to give you just as an example, you can see here that only about 65% of farm workers in 2020 had seen a healthcare provider, whether that be for any injury, routine illness, or preventive care. We see a lot of common health and safety concerns among farm workers. Obviously, there's occupational health concerns like injuries and illnesses. Like, for example, you're doing a lot of physical labor, so there's probably some musculoskeletal issues. If you're working out in the crop fields or with different types of chemicals, you may have eye injuries or respiratory illnesses. Sometimes exposure to different chemicals or different crops can also create skin disorders. People often have pain or chronic pain. Sometimes, especially like in livestock production, you may have noise-induced hearing loss, or folks that are working with agricultural equipment and tractors. You can have some, those are loud, and you can have some hearing loss there. Zoonotic infections, or those diseases or infections that go between humans and animals. The interaction itself between humans and animal handling is a serious concern. We see a lot of issues with that. There's weather exposures, whether it's extreme heat and sun, or cold exposures, chemical exposures, pesticides, access to sanitation facilities like water and bathrooms during the workday, and of course, fatigue and not having adequate time to recover between one day to the next. If you're working 6-7 days a week, 10, 12, 14 hours a day, that doesn't leave you with much time to like catch your breath between shifts. And of course, there's general health concerns, like I mentioned, the access to healthcare. There's behavioral health concerns in terms of mental health concerns and adjustment or acculturation to a new place. Chronic conditions, for example, obesity and diabetes, hypertension, the fact that people are moving, and so there isn't this continuity of care between providers. And of course, health literacy and oral health issues are also concerns. So immigrants in agriculture are classified by the National Institute for Occupational Safety and Health as a vulnerable worker population. So there's a number of reasons why. Of course, they're doing hazardous work, just like everybody in ag. There's dangerous conditions. There's a lot of demands. You're working long hours, not enough time to rest. There's a time pressure, because usually you got to get done quickly on whatever it is to get it out to market, and a lot of repetitive tasks. Now, those are common regardless if you're an immigrant or if you're not. But what adds to the vulnerability for immigrant workers is some of these language, cultural, and logistical barriers that I described. The fact that oftentimes these workers have little to no safety training or personal protective equipment. We've talked to a lot of folks that say, oh yeah, my employer, they put a video on, but it was in English. So they put the video on, they can check the box that they technically provided a training or information on some of the safety risks, but the person may have only spoke Spanish. So did they understand it? Perhaps not. There's these low levels of formal education and literacy, and as I mentioned, the fear and discrimination and the lack of knowledge around these labor rights, and a reluctance really to speak up about some of these dangerous conditions or the unfair treatment because of what may come, some of those repercussions that may come. So ag work, it's generally dirty, dangerous, and demanding, and for immigrant workers, sometimes even more vulnerability than just that. So when we think about Nebraska, a lot of times people think that immigration and immigrant workers, farm workers, or people working in other industries is a new phenomena. But definitely not in the ag world. There's a long history of farm workers coming to the United States and to Nebraska from Mexico and other places. This is a picture from 1926, and here you can see there was 85 Mexican beet laborers who are coming to work in our sugar beet fields out in the western part of our state. So trying to show you that this is, this is not new. This is something that has a long history, and there's a lot of social implications for how people have come to this country and how they continue to be treated within this industry. So when we look at Nebraska, we have about 1 in 4 jobs in our state that are related to agriculture. You can see here that every dollar in ag exports generates $1.03 in economic activities for our state. So we have about $7.1 billion in exports, which translates into about $7.4 billion of additional economic activity. We rank number 1 in commercial cattle slaughter, so meat packing. We rank number 2 in production of cattle and calves, cattle on feed in feedlots, and I'll talk more about that, beef exports, commercial red meat production, and ethanol production. Third in corn, and fourth in beef cows. And so sometimes Nebraska is referred to as the golden triangle because we're able to produce the corn, which helps to feed the livestock and helps to create ethanol, and byproducts also come from corn and also help to feed the livestock. So there's a lot of synergies in the types of things that are produced here within our state. So I mentioned cattle a lot on the last slide. And cattle production is, could be argued the most important agricultural industry in the United States, which continuously accounts for the largest share of total cash receipts in terms of ag commodities all across the country. So it represented, just in the past year, cattle production represented about 17% of the $391 billion that came from ag commodities. We have the world's largest fed cattle industry and the world's largest, we are as a country, world's largest consumers of beef. And so the beef industry is typically divided into two sectors: cow-calf producers and the cattle feeding sector. And you can see here on the slide, there I've outlined our central states region, but all those green dots say those are, that's the size of the cattle feeding industry in that state generally. So you can see Nebraska and Texas kind of go head to head. And on the bottom of the slide, you can see comparisons in terms of the number of head by state. We have a lot of cattle, or the number of cattle that happen to be here in our state on feedlots. So you might ask, what is a feedlot or a feed yard? Those are synonymous terms, but a feedlot is the final stage of cattle production. It's basically an animal feeding operation where you feed steers and heifers, grains and rations of silage and hay and other proteins to supplement and produce beef. Ultimately, all of these cattle are going to end up in a meat packing plant somewhere around here, and they will be beef or hamburger or other beef types of products in our grocery stores. And so cattle typically spend about 3 to 6 months in a feedlot. We grain finish most of our beef in the state. There's not so many people that are allowing their cattle to eat just grass. We really rely on corn and grains. And so the feedlot industry is quite large in our state. And this might be a little difficult for you to read, but if we look around on the top portion of the slide and look at Nebraska, we have 254 cattle feedlots in our state. We have the highest number of feedlots out of any of the states in our central states region. We have the second highest number of feedlot workers, second only to Kansas in our region. So we have more actual feedlot operations, but fewer workers than Kansas. You can see that Kansas has about 3,000 workers as of 2018, and we had nearly 3,000 workers here in our state. So it is a large industry. Looking across ag, if we were going to divide it out between crops and livestock, we can see here with the yellow or yellowish lines that animal production has a higher rate of fatal injury than does crop production. And it's been kind of going up since about 2016. You can see that line moving up, the trend. And we also have a higher rate of non-fatal injuries in the livestock side, in the animal production side, than they do on the crop side. So if I told you, crop work was dangerous, animal production is even more dangerous. And we see a lot of the injuries on the animal production side are coming from animal handling. So like, for example, treating cattle in an enclosed space, like in a pen or in a chute, or trying to move cattle from one place to another. We see, or trying to move them like onto a truck. There's a lot of injuries that happen in those types of activities. And so I tell you this because, ag has the highest rate of fatal injury out of all industries. And here you can see, if we break it down, that the animal side is even higher than the crop side. So it's quite significant. And the same is true here on the non-fatal injuries. We have a lot of non-fatal injuries, and more so on the animal production side. So when we think about this idea of feedlots and safety, we know that all organizations have a culture, right? And feed yards are no different. They also have culture. It's defined by languages and custom beliefs, rules, knowledge, and this collective identity that people may have. And so there are some attributes to organizational culture, one being that it's sort of relatively stable over time. It's transmitted to new workers, grounded in the history and traditions of the company and of the industry. And it has both breadth and depth, and it sort of provides an order to the way things work. And so cattle feed yards are, as I said, are no different. They also have a culture. And so some of my colleagues and I have been working on a project to try to look at feed yard safety culture. And here's some of the primary insights thus far that we've learned. That, workers they experience plenty of difficulties, and they have persistent risk to their health and safety. But they adapt to that 3D type of work, the dirty, dangerous, and demanding working conditions. Feed yards have some minimal safety training, but there's definitely a willingness and an openness and a desire for more safety training resources and materials. And in the absence of these kind of training materials, the workers have self-organized systems for managing the risk and trying to foster safety. So for example, in this sense, a cowboy is somebody who may be checking on the cattle and riding pens. So they ride on a horse, riding through the pens, making sure the cattle are healthy. If they're not healthy, they pull them off and they take them out. But the cowboy is sort of like at the pinnacle of the social hierarchy of the feed yard. And so sometimes that cowboy is seen as the mentor or the teacher. And so one of the ways that we've seen this work is that the cowboy buys into safety. They're able to pass on that information and that, that value of safety to other workers. And some managers have taken some measures to try to reduce injuries. Trying to change some of the mentality, trying to hire only specific people with sets of skills like working cattle, rather than having somebody who comes in, like I'm a rodeo cowboy type of thing, but trying to hire in the right people. And they see that one of the major concerns is the loss of of people who understand agriculture and who have this background in agriculture. So that oftentimes now they're hiring people because they need a body rather than having the people who've had some experience in the past. And so some of the feed yards are also seen as places as, the last place that you can actually be a cowboy, because, if you know some of your history of, how this area of the country has developed and progressed, there used to be long cattle drives to get the cattle to market, and none of that happens anymore. And so you're kind of relegated to the feed yard. And so oftentimes the people who are working in these feed yards, they find it as a place to be able to express their freedom and their desire, but it's also a place to really improve the lives of themselves and their families. Okay, so now I've given you a little bit of background about farm workers generally, and we've talked a little bit about the cattle industry and the cattle feeding sector in particular. Now I'd like to share with you some of the work that we've been the study that we've been working on over the past 5 years, and that's that health and safety of Latino immigrant cattle feed yard workers in our region. So over the past 5 years, we have conducted 243 interviews with Latino immigrant feed yard workers in Nebraska and Kansas. So we focused on Nebraska and Kansas because those are the two states with the highest number of feed yards and the highest number of workers. Interviews lasted about an hour to 90 minutes. They were conducted in English or Spanish, depending on the preference of the worker. I think maybe all but 1 or 2 were done in Spanish, and workers were compensated for their time. So to be eligible, they had to identify as a Hispanic or Latino immigrant, be of the age of majority in the state where the data was collected, and currently be employed on a cattle feed yard. So here you can see most of the people that we've talked to are males with an average age of about 38 years old. Most are from Mexico, but following all the general trends, we do see a number of people from Guatemala and El Salvador. Most people had spent some, decent time in the United States, on average about 12 years in the United States. But we did see a lot of limited English proficiency and low levels of formal education, very consistent with what we're seeing with ag workers across the country. You can see the average weekly pay here was reported by the workers was $677. Most of the folks we talked to had been working cattle for about 6 years, and at their current job, they were working 10 hours a day and 6 days a week. That's about 60 hours a week if we're doing our math. So if we want to do a little bit more math here, 677 divided by 60 hours a week turns out to be about $11.28 an hour. Doesn't sound like all that much for the type of work that people are doing. You can see by the graph on the top of the right-hand side of the slide that most of the people we talked to were processing cattle and doing pen riding or cowboy type duties. We had about 50% of workers who were doing feed delivery. That means like driving feed trucks and actually getting the grains out to where the cattle can eat them. And another 48% were doing some sort of maintenance type of task, whether that's welding, building fences, putting things back together that may have broken. 44% were involved in the hospital or taking care of sick animals, and about 31% were in the feed mill, and very few were in administration or security types of tasks. So among our population, we found that about 58% did have health insurance, but only about 36% of the workers we talked to had a regular healthcare provider. So they may have been paying for insurance, but they themselves were not actually using that all that often. Most of the people we talked to said they had pretty good health. If you know that question, how would you rate your health? Excellent, very good, good, fair, or poor. We combine those, dichotomize those. So about 90% said pretty good. We did see a lot of people who reported being overweight or obese. We saw about 30% who had some sort of chronic health condition. The most commonly reported health condition here, chronic health condition, was cholesterol. We had about 42% who reported having some sort of current physical pain. We didn't see as much on the mental health side in terms of anxiety and depression as we've seen in other groups of farm workers. For example, in past studies of migrant farm workers, we saw much higher rates of depression and anxiety than what we see here. And we did see that there was quite a bit of risk for problem drinking, and a higher than average in our state percentage of people who were smoking cigarettes. About 71% of the workers we talked to had been injured on the job. And so they were experiencing about an injury a year, and some reported many more than that. Most, as you might guess, were due to animal handling, to the tools and equipment, and slips, trips, and falls. If you think about a feed yard, you're working in all weather conditions. It might be icy, it might be muddy, and you still have to get out there. So slips, trips, and falls is a pretty big concern. Most people were using first aid on site, but we did see about 40% of workers who actually had to take time off due to their injuries, whether that be a half day or more than that. And about 40% believed that it was pretty likely that they were going to be injured on the job. And very few were sure if they were going to qualify for unemployment benefits if for some reason they lost their job. We did see that there was a lot of people were concerned about health and safety and preventing injuries because they needed the job because they wanted to be able to take care of their families. So they're, and that's their words. We ask them, why is health and safety important to you? And by and far, the most common response is because I need to take care of my family. We saw a lot of workers say that, taking risk is just a part of their job. They understand that it's risky. So we asked them about different areas of safety climate, and you can see some of the responses here on the slide. But overall, safety climate was significantly negatively associated with reporting a work-related injury. That is, if safety climate goes up, work-related injuries go down. We've also been testing an ecological stress-based model of immigrant worker health and safety. And so on the top of this slide is our model. We're looking at contextual and background variables, interpersonal variables, current stressors, and how those affect health and safety outcomes as part of this project. And so I'm going to just share with you results of one of the tests that we've done here in a minute. So in this study, with this data, what we did is we looked at the work context. So we looked at the number of different PPE or personal protective equipment that were provided to workers and the number of types of trainings that people may have gotten from their employer, whether it be a video training, an in-person classroom training, hands-on training, mentoring or shadowing, and those types of things. And we looked at the relationship between those and safety climate. And from what we saw, that the more types of PPE and the more types of training, that led to higher levels of safety climate, or one measure of a safety culture. And if safety climate is better, then there was a reduction in stressors that people experience. And stress itself was, if stress is going up, then people were more likely to report depression or anxiety or have this need for recovery, right? Remember, I talked to you about fatigue and not having this opportunity to kind of catch your breath. That is what we call need for recovery. And if stress was up, then life satisfaction tended to be lower. And so this is just one example of the way that we're using our model to be able to test various components of the work environment and how they affect and influence workers throughout our study population. We did ask workers about their preferences for trainings and what is it that they want to learn? How do you want to learn it? So how can we get this information to you? And by and far away, people wanted to have in-person training at the workplace. With our population group, this is probably one of the best ways to reach people, the most time-consuming, resource-intensive, but probably one of the best ways to reach people is actually coming out to the work site. They also mentioned videos would be a good way to provide some educational materials. They were very interested in figuring out how to manage risk at the feed yard, but then there was also personal interest in various topics, whether it be from workers' compensation to how do you prevent injuries or low stress cattle handling. So we did hear a lot, and we're trying to take all of what we're learning from our workers and being able to translate into action and into resources that are specifically tailored for them. So no talk, I think, in the age of COVID would be complete without talking about the impact of COVID. And as most of you know, that COVID had a really huge impact on the agri-food sector, and especially on the farm worker side and on the meat packing side. And so if you look at the map there, those represent different outbreaks. The blue dots represent farm outbreaks. We didn't see so much farm outbreaks here that were documented, not to say they didn't happen, but that we've been able to document. But across the country, it's had a tremendous impact on farm workers. Part of that is because of the proximity that people have with each other, the duration of the contact that they have with one another, the limited sanitation supplies that are in fields or in ag production operations, and sharing equipment and tools and vehicles and shared housing and transportation with other workers. And so, farm workers have a lot of vulnerability on a normal day, but then you add in COVID and it's like exponentially increased their risk. You can see that through the Food and Environmental Reporting Network that 107 farm workers had died from COVID-19 that they were able to document. Now, knowing that very few states actually kept track of this. So what did we do to try to reach workers during the pandemic and try to get information to them? Well, we had to pivot just like everybody else, because as I mentioned, people wanted in-person types of activities, but you can't do in-person types of activities, or we couldn't at that time. And so we had to switch to virtual outreach. And so we created a couple of infographics that were related to COVID-19 prevention strategies and to, mental well-being and coping. And we used Facebook and we boosted these posts. We paid for some boosted posts and we had a really great reach. These actually went out long before OSHA and CDC came out with any guidelines for ag producers. These were actually posted in April and May of 2020. And we found that this was a really cost-effective method for being able to reach our workers. And it also responded to what we were hearing from our data too, that workers were interested in respiratory health, issues, and who wasn't interested at the beginning of 2020, and what COVID is and how do we deal with it. And so we found that this virtual outreach is a way that we could extend and supplement our traditional outreach strategies. Okay, and so now we've been talking a lot about how do we increase the uptake of COVID vaccines among this population. So we know that we need to be able to tailor our strategy based on what's going on within the agricultural industry in your area. We need to use trusted partners. Like, hey, I'm from the university. Sometimes that doesn't work so well with farm workers who may not be from around here. And so having those partnerships and relationships established long before you need them is really, really important. And then, thinking about who are the right partners to bring to the table. How do you standardize, information and health education? For example, is there a way to make it part of your training process as you're hiring on new workers? Can we try to bring a health department clinic on site if we have a significant number of workers? Or can we get them some paid time off to actually go and get vaccinated? So thinking about some of those strategies, I think is going to be very important, particularly as we move into this kind of next phase of the pandemic. So everything I talked about today is really encouraging you to think really much more broadly about farm worker health. It's not just about the occupational health concerns, but it's about, the relationships that farm workers have. It's about the local community and the resource and how do people access those, but it's also about societal policies and how do we structure our society to be one that's fair and just for everybody. So if we take some of this work and we think about the work context, let's start there. That one's relatively easy. We use the hierarchy of controls. And so think about this triangle, think about Maslow and, it's upside down Maslow. And here what you can see is that, the most effective strategy is to physically remove a hazard from the workplace. Sometimes that's just not possible. Is there a way to substitute out the hazard? Is there a way that we can change the process, engineer out the process to isolate people from the hazard? Sometimes there is, but oftentimes we have to rely on the last two rungs of the upside down triangle, and that is the administrative controls and work practices and the personal protective equipment. So we try to encourage much more training, making sure people have resources and access to information and to the personal protective equipment that they need. But then we're also trying to work with feedyard employers to try to improve safety culture, like thinking about practices that can actually take us the next step and changing the culture. Oops. On the education side, of course, there's lots of modules that are available. All of the ag centers collaborate on a YouTube channel, which has lots and lots of videos in English, Spanish, and sometimes even other languages on various occupational concerns. Here at the Central State Center for Agricultural Safety and Health, we also have a page of Spanish language resources. Those are publicly available. But as I mentioned, what we want to do is really change culture. It's not just about information and resources, but it's about changing the culture. And that's hard work and really time consuming. But we know that there's a link between a positive safety culture and improved safety outcomes. And safety culture is something that's transmitted both explicitly and implicitly. And so how do we foster it? Well, we need to have leadership support. We need to model the behaviors that we want. We need to create an environment where people can talk about things that are happening without fear of punishment or retaliation. We need to have some way to evaluate people. We should support reporting near misses, which are accidents that didn't happen but really could have happened. Support the reporting of unsafe conditions, and thinking about how do we promote collaboration among workers, among supervisors, and among leadership more generally. So that really is I think one of the core issues is changing this culture. Like, we know that agriculture is risky as a workplace, but it doesn't have to be, where you expect to get injured. Like, there's a lot of ways that we can work around that and create more of a culture of safety. So if we move outside of the work context, then what else can we do? Well, we educate workers, we inform them of their labor rights, we can encourage, and foster this building of trust. And the community, we can try to create and enhance our outreach strategies to better serve the population, and try to improve delivery of legal aid or medical services, healthcare services, public health types of information to farm workers. Those are things that we can do. On the healthcare side, let's see, we could, think about how do we incorporate occupation into the medical record? Like, do we know where all of our patients and all of our clients work? If not, why not? And if they're a farm worker, we could probably flag that in their chart. And we can make sure that we're adhering to the class standards of culturally and linguistically appropriate services so that there is, these types of resources available. We should, learn from our patients, listen to them, be able to explain where we're coming from, acknowledge the differences, and figure out and negotiate a treatment plan with them as partners. We need to think about the community structures too. Are services available? Are they accessible? Are they acceptable? And are we providing quality, right? Those are core elements of service provision and the right to health. We know that if we're serious about improving farm worker health, that we really need to drive down this pyramid and looking at some of the socioeconomic factors that can really create a lot of change and improve health and well-being, not just for the farm worker, but for their family and for the long term. Lots of policy implications that come from our work. I'm going to skip through this. I do want to just touch on this last component here, is that we want to encourage more structural competency. This is one of the conversations that we've been having ongoing within the ag world, is how do we do this better? We're really good at creating materials and training, but we've got to go farther than that. And so Paul Farmer, which you may have heard about him, but he's a Harvard trained anthropologist and physician and human rights activist. He just recently passed away, but he talked about this idea of pragmatic solidarity, and it means going beyond compassion and empathy to find ways to alleviate suffering that are consistent with the ground truth of those experiencing the injustice. So it's more than just, I care about changing, the way that, the structures in the community, but we actually have to do something. So thinking about who's impacted, why is it unfair, who's responsible for it, and how would it be fair? How can we change the structures so that they are much more fair, and thinking about intervention. So again, moving from the data, but to actually intervening at various levels within that socio-ecological model. Lots of resources are available to assist and serve farm workers, Migrant Clinicians Network, the National Center for Farm Worker Health. And as I mentioned, we do have some Spanish language resources here at Central State Center for Agricultural Safety and Health. All right, we are getting to the end of it. This is just a reminder that we have to think about the root causes of the health disparities that people are experiencing. And some of these ideas around social policies or legal policies, those really are health policy and can drive change. So we have to think broad, because people are not commodities and we can't continue to treat them that way. All right, with that, I want to acknowledge my partners and all of the people who work on this project with us. And of course, we are funded through the National Institute for Occupational Safety and Health. With that, I'm happy to take any questions.